a
And
regular
other
checkup.
preventative visits, yeah.
And so this tax on ultraviolet lights in a tanning salon, sort of saying that if you don't do that, it's a preventative measure, so if you're going to go, we're going to charge 10% tax on that.
Interesting. Other quirks or other things that you can share with us about the healthcare reform that you know of?
The
The
transparency.
transparency
Yeah.
in insurance companies, they have to now disclose how much they're spending in overhead, so everything has to be revealed. As it exists right now, they're not very transparent, and lo and behold, when somebody gets a large raise, what results is larger premiums.
We're staying away from
Yeah.
politics, but
Yeah,
I
I know.
believe one of the candidates for governor actually
has
raised that
addressed
as an
that,
issue
yes.
with our local Blue Cross and what they were spending for salaries and so forth. Well, what would happen under the act is the companies that spend more than, is it 80% at some point they have to spend at least 80% on medical bills and medical claims. If they spend more than that on overhead and salaries and so forth, there's a penalty for the insurance company, and you get a rebate as a consumer.
As I understand it, between the market access, the healthcare reform bill is supposed to help. That's one issue, but it was also a two-pronged effect. It is supposed to help with the operation of medical care being distributed. So I think that's probably along those lines. I don't know what else it's going to do in terms of hospital or medical facilities operations, but it certainly looks like it's trying to address that. And what you're saying about the transparency, does it mean that I will now know about how much of that $100 is going to my care versus their overhead, or just the insurance company is going to know?
No, I would
No,
say the public needs to know. It has to be
that's the
disclosed
whole idea.
publicly.
And
Yeah.
I'm not
Good.
sure if it's going to be through those exchanges that each state will set up, where that'll be monitored, but at some point, the states will be monitoring exactly that information, and I'm sure it'll be public information. With the internet today, everything is.
What do you have to say about the fact that there are some people who are currently covered, they're working, their employer is covering their health care, and why do I care about health care reform anyway? I could only be standing to be in a worse place later on rather than a better place. I'm probably going to have to spend more for my insurance. Am I supposed to be very excited about or entirely thrilled about what's going on with the health care reform?
Well, I think the whole idea of the act was to reduce the costs. So
Will it?
Yeah, well, here's the theory on that.
the theory is your costs are going to be
Yeah.
Theory
reduced.
is?
You're not going to be denied coverage. Okay, you're not going to be denied coverage.
And what you're talking about is,
Because of
I've got
pre-existing.
coverage. What about all those people who don't? Well, the hospitals, for example, if I go to the hospital with no insurance, they're still going to treat me.
Yeah.
There's a cost for that. And there's been a lot of debate back and forth. And again, not to take a political side one way or the other, part of the debate is there's a big cost for people who have insurance paying for those who don't.
Yes.
Because the hospitals still have to get money somewhere, so theoretically, if everyone has coverage, that
They'd
hidden
eliminate it.
cost, as they call it, will disappear.
So, again, the uninsured, it's meant to help the uninsured, and we talked about this at the beginning of the program. Isn't it nice? I'm not sure now I am going to be working or how much longer I'm going to be working. Maybe I'd be better off not buying or into this healthcare insurance because it would just cost me a whole lot less if I just had to pay the penalty. And initially, that seems like a smarter option. I think you can pay up to 1%. It's $100, maybe up to $1,000, who knows, $2,000. But that's surely a heck of a lot less than what any insurance premium is likely to be.
But what I said before, you take the risk of having some fatal illness, then it's going to cost you a lot more.
If you're a younger person, well, I'm not arguing for this,
Right.
but when you look at the cynical side, if you're a younger person, I think your odds-on bet, I'm healthy, I'm young, nothing's
Okay.
happening, I'm invincible.
So somebody gets in an automobile accident. They don't have insurance. You could have MedPay as coverage on your auto insurance policy. MedPay only limits what they will, there's a limitation on
Right.
MedPay is how much they will spend. So anything over the MedPay is ultimately going to come out of your
And
pocket.
assuming it's somebody who's opted not to have health insurance, they probably opted to have the minimal coverage, which on MedPay would be $2,500,
Yep.
and everything else is out of pocket. They'll fall into that formally 62% of people who have to file bankruptcy because of medical bills.
That's right.
Before all of this passed, it was a contentious issue. People who were on Medicaid, Medicare, they were concerned about how they would lose in this game. How did that play out?
I think right now it provides early retiree benefits for those between the age of 55
Right.
to 64. So it would help reduce the expensive cost of coverage, because as we know, going back to age, the older you get, the more expensive it is.
Right. And that's right. The Healthcare Reform Act does cover some help to businesses that will provide health insurance for early retirees for that point in time between the time they retire and the time they'd be eligible for Medicare.
Have you heard, or what can you tell us about what the exchange is actually going to mean? That's something that's going to have to be phased in, but for if I'm an employer and I'm looking to help my employees, do you have any sense of what that's actually going to mean for me and when I have to start working on that to make that happen?
Well, the insurance exchange is supposed to be in place in each state by 2014. And again, it's state by state. How it's exactly going to look, I think it's too early to tell. The point of it is even in debate between different people. Some people think the point of it is to have all these different insurance plans so that you're comparing them premium to premium for the apples to apples coverage, and therefore the states bundle the policy so that you can get a lower or cheaper premium. But what exactly is going to happen, I think, is still a little premature for us to be able to tell you.
It should be you have more to choose from.
That's the idea.
Yeah, so
and competition
That's
so
right,
that the price is
competition, and
lowered.
so that you're not limited to one or two plans. And as we know, in Rhode Island, there's really only two
Right.
major companies that offer health insurance.
And take Massachusetts, if you want to think about what it might look like, because Massachusetts has already started to
Here.
do this.
Yes.
And so if you look at the Massachusetts plan, there is some state component to the coverage. And that might be what you see in each state, a state option, private options. Private insurance companies are not going away. They're a big player in this.
Again,
Even
but
though-
the state option is going to be predicated upon your income.
Right. And there's some talk about it's 133% of
Poverty
the,
level. Yeah.
Right.
Between 100 and 133 and 400%.
Depending on what exactly it is that you're looking at.
What other things do you think that we need to be aware of, how this healthcare reform bill will affect our lives?
A customer appeals process should make it
Explain.
much less rigorous than what it is right now. Going through red tape to appeal a bill presently is just
Impossible.
Impossible. And by the time you get an insurance company to agree to pay the bill, it's like 7, 8, 9 months
Right.
will go by, and the next thing you know, you're being hounded by hospitals or collection agencies.
Most insurance companies, health insurance
Yeah.
companies, have a utilization review.
That's right.
And they deny your coverage. It, to me, reminds me a little bit of that Capital One commercial where they deny.
Yeah,
You know, you want to use your rewards, deny. You want to use your coverage, deny. And as Jackie's explaining, you go through this whole process, and by the time you need it, hopefully you're still alive to be able to get the coverage, the test or the visit that you need to have.
So theoretically, we don't have much time about this, but theoretically, if what you're saying is true, then if it takes less time, it should also cost less to
That's right.
deal with that.
That's right.
And
That's
that
the idea.
was a
'Cause
goal.
you're not paying any, late fees or
Right.
penalties.
Important. Anything else that you think that we need to know about with healthcare?
Well, I think we've covered a lot of what we already know about. I think that at some point, as this gets rolled out, we need to do another show to really talk about how it's actually being implemented. There's always a disconnect between how the law is rolled out and how it's intended to be. So we have to look at that.
We'll stay tuned, and I'm sure there'll be more on it shortly. I think when we get together for our next session, we will talk about another critical issue, back on things that are happening, whether it was the flood and flood insurance, or the licensed home repair people, and how not to be scammed, and also if you're a homeowner and you're looking to not be a scammed borrower, RESPA. I think we said we were going to speak about that last week. We will do it soon. Please stay tuned. The discussion about legal matters continues. And so we will do that.